Hey friends, Dr. Corey Babb here. After my last video, I received a number of direct messages from women who were breastfeeding, who had small kids, were immediately postpartum, kind of in that whole mom world, asking if there are some things that they could do to help deal with their low sex drive. So I've put together some tips and tricks today, and also I wanted to delve into some specific discussions because, trying to go from being the nurturing maternal figure and switching almost at the drop of a hat to your old seductress self is a very difficult and oftentimes impossible task. So join me on this week's Intercourse Discourse, where we try and restore the Mommy Mojo and get your sex drive back. Now, if you were unable to see my video previously on low sex drive, or you just want a refresher on some of the neurochemical causes or kind of the discussion that we had last time, I'm putting a link to that previous video right there. So you can go and check that out at your leisure and hopefully get some background on the topic. Now remember that sex drive or libido or sexual desire, or kind of whatever you want to call it, is really an interplay between two main neurochemical hormones, serotonin and dopamine. And in the example we used last time as kind of the sex drive car, serotonin is your brake and dopamine is your gas. Now obviously those neurohormones are extremely important, but we can't forget our gonadal or reproductive hormones and how they affect sex drive too. I'm talking really about estrogen, progesterone, and testosterone, and these hormones specifically play a part in why a lot of either new moms or nursing moms experience some issues with sex drive. So now, if you've ever been pregnant before, you know that there's a lot of physiologic changes that happen during pregnancy. Obviously, there's a baby growing inside your uterus, or maybe 2 or 3 or 9 or however many you have, but there are also some other anatomic changes that go along with that. You may notice that your hair gets a lot thicker, or your skin gets darker, your breasts get enlarged, things along those lines. And one of the main causes from a hormonal standpoint of those changes is an increase in estrogen that occurs as a response to pregnancy. Now, as pregnancy progresses, that estrogen level rises, testosterone can kind of rise too through a mediated form of an increase in progesterone. But then after delivery, almost all of those sex hormones drop pretty quickly. This is one of the reasons that we think may lead to the development of postpartum depression, as there are quite a number of estrogen receptors in the brain that are very sensitive to that rise through pregnancy and then that drop. Now, outside of those emotional changes, we also see changes in a woman's overall physical appearance. Vaginally speaking, the vagina and the vulva, which are both very estrogen sensitive, experience an actual atrophy or kind of a reduction in size following delivery. Now, breastfeeding actually increases that, as prolactin, which is one of the hormones that your brain secretes to help promote lactation, really creative name there, actually is an inhibitor of estrogen. And so women who are breastfeeding not only have that normal postpartum change in vaginal atrophy, but actually experience a substantial increase in those symptoms as well. What this means from a sexual standpoint is that you have a vagina that is now almost menopausal in appearance and function, and therefore has a lot of the same issues that a menopausal patient would have in terms of intercourse. Namely, she may experience vaginal dryness, sex can be very painful, and she may even have tearing or small lacerations on the inside tissue of the vagina itself. And obviously, pain is one of the main causes of low drive in terms of sexual functioning. If I say I'm going to hit myself with a hammer, well, my body's like, you shouldn't do that, that's going to hurt. Same type of thing you can extrapolate to, for sexual experiences. If you know it's going to be painful, it's going to cause a decrease in drive as your body tries to prevent you from experiencing that painful situation. If we then use that information, we can talk about some of the treatments that we can sometimes use for postpartum painful intercourse, namely localized hormone replacement therapy, or sometimes the use of increased lubricants or moisturizers. Now, before we talk about hormones, let's talk about those kind of lubricating therapies. So obviously there is a difference between a lubricant and a moisturizer. A moisturizer, much like if you were using on your hands or your face or things like that, allows tissue to retain moisture within it and therefore be more pliable and more resistant to damage. Just as we age normally and our skin becomes a lot more friable and thin, using a daily moisturizer can help it maintain some of its more youthful appearance. Well, the same thing goes for the vagina. We know that the vaginal mucosa, the cells specifically in that kind of outer layer, tend to be very fluid filled. And as they enter a more menopausal state, that fluid layer tends to, for lack of a better term, kind of evaporate or thin out. So therefore, using a moisturizer can help actually retain that moisture in that vaginal tissue and help it to be more accommodating to sexual intercourse. Moisturizers are usually used a couple of times a week or so. Some are more often than that, but you use them regardless of sexual activity. So even in a woman who is, let's say, 2 weeks postpartum, we obviously don't want her to be engaging in sex yet, because if she's had any type of tears or she had a C-section, want to make sure everything heals, she can already start to use a vaginal moisturizer to help some of that tissue retain some of its elasticity. Now flip that around and you have vaginal lubricants. Lubricants most people know of in the terms of things like KY, or you can use coconut oil, or any type of petroleum jelly, or whatever you want to do, basically act as a barrier to that inner vaginal tissue. So it allows things to kind of slide in and slide out, as you will, with a decreased amount of friction. Remember that friction over, a tissue over and over and over and over again causes some discomfort. It's kind of like the old, Indian arm burn or rug burn thing you may have. If you can try and reduce that friction, obviously you're going to have less pain with that activity. Now, hormonally speaking, obviously you want to be careful, especially if a mom is breastfeeding. Systemic hormones, whether that's in the form of birth control pills or actual hormone replacement therapy, can potentially affect both milk supply, and if they're in high enough amounts, may actually be transferred to baby, especially if baby is exclusively breastfeeding. As such, if you're going to go down the hormone replacement route for these type of symptoms, you want to make sure that what you're using is more of either a localized effect or is at a very low dose so that it doesn't affect supply. Now, breastfeeding moms, especially if their supply is well established, they've been breastfeeding exclusively for a number of months, usually don't have to worry too much about a drop in supply if they go on something like a birth control pill. But still, the current recommendations for breastfeeding moms, especially if they're wanting something hormonally to help with painful intercourse, would be something localized without any type of systemic spread. Now, stepping away from the nursing mom, let's look at the mom that has maybe a lot of kids running around. It's a very difficult thing, like I mentioned in the intro, to switch from that, what I've kind of called saint to seductress. When you're momming all day, you've got kids to take care of. If you're a stay-at-home mom, you've got all the jobs that go along with that. If you're a working woman, you've got professional things going on too. It's not fair to expect you to go from being, Susie Q housemaker at one moment to being, your seductress of the streets, or whatever you want to call it, the next moment. Like, it just doesn't happen that way. Women are much more interactive when it comes to sexual response, as opposed to men who tend to be more reactive. And so there has to be a degree of emotional courtship and emotional security in order to start that cascade towards improved sexual desire and improved arousal. So what can you do? Obviously, one of the best things you can do if you are a mom with small kids, and if your partner's watching this, I hope that they take notice too, is to try and take you out of that mom mode. Go on dates, go on vacation, something to where you can focus just on the two of you. And you're not having to worry in the back of your head, what are the kids doing? Do I have, work I have to do tomorrow? Whatever it may be. For some reason, men have developed this ability to do that a lot easier than women. I don't really know why. I'm sure there's some sort of evolutionary or teleologic reason for that. But for the majority of women out there, there has to be that separation between mom and partner in order to have a good return of sexual functioning. So, there really is a courtship that's required. And I think about my wife and I, we've been married for a number of years. And even if we go on a date or even if we go on vacation or things like that, it still takes a little bit of time in order for her to kind of get out of that mom mode and get more into just where she can focus on just the two of us. So there has to be some degree of patience there, and there has to be some effort put in by the partner in order to elicit that response, in the mom that may be watching this right now. Now, another thing I want about is kind of the symptom of being overtouched. If you're breastfeeding or if you have small children or even if you're around kids a lot, they are very touchy. There's nothing wrong with that, but it's very difficult if you've been touched all day to suddenly want to, almost at the drop of a hat, to be touched by your partner in a albeit very different sort of way. And so that's another thing to think about. If you are a mom who's breastfeeding or if you have small kids, you can try and kind of limit that contact, especially if you yourself are wanting to pursue something more sexual later on in the day or, on the weekend or whatever it may be. Try and kind of slowly and obviously in a very gentle way, reduce the amount of contact from your kiddos or whoever it may be so that you can better focus on, what more sexual touch or at least more intimate touch feels like. Now, from that last video, we talked about that brain plasticity or the ability of the brain to be able to kind of create new neural pathways when it comes to sexual functioning. So if you have a mom who has had, kids running around all day, she's kind of getting overtouched, or maybe she's breastfeeding as well, kind of hitting all of these specific things that we've talked about already, something that you can really do is when you have that little bit of private time for yourself, if you can find it, really try and engage in some of those focused or very direct, sexual thought patterns. Try and think about more intimate thoughts with your partner, or if you, have time to read a book, maybe consider reading some erotic literature or things like that. These are things that can help, get your brain out of that, saint maternal mode and really kind of turn it more into that seductress standpoint. Now, lastly, I wanted to talk a little bit about medication. Something that we also see is that moms who are, newly postpartum and they may want to talk about birth control. Well, a lot of birth control actually, as one of its side effects, can lower the sex hormones, like I talked about earlier, even more. So it's not uncommon to have a woman come in and say, my sex drive was fine, then I went on birth control, and now it sucks. So couple that with, having small children or breastfeeding, and you really have a woman now who has virtually no libido. So there are forms of contraception that are still really effective, but don't have that same hormonal side effect. So you may want to talk to your healthcare provider about that and see if there's a different type that you can use that doesn't have that same hormonal effect. Lastly, I think it's really important to talk about obligatory intercourse. Now, I unfortunately hear a lot of women say, I want to be a good wife, or I want to be a good girlfriend, or something along those lines, and they feel that even if they don't want to have sex, or they're tired, or they, don't feel up to it, they feel that they have to do that to maintain keep their partner happy or maintain their marriage. Obligatory intercourse is one of these things that leads down a very dark rabbit hole towards feelings of resentment, can lead towards pain, especially if it's hurting and you're still trying to do that kind of obligatory sexual activity. So if you are feeling that way, really do have that discussion with your partner. Or bring your partner into your appointment with your women's healthcare provider and have them hear, hey, it's normal for you to have that low libido in these circumstances, and there are things that we can do about it. The last thing you want to have happen is to feel obligated to have sex, then turns into feeling obligated to have painful sex, then turns into some of the more actual sexual pain disorders as a way of trying to avoid that sexual activity. So please, please, please talk to your partner about that and do not feel obligated to have sex with them. This is something that should be joining the two of you together on not only a physical but an emotional, spiritual level too. Having that sense of obligation often just leads to resentment and can lead to problems down the road. Well, friends, that's it for me today. I hope you enjoyed this discussion on kind of ways to get your mommy mojo back. Are there things that you have done that you think have worked, or are there questions or concerns that you have? I'd love to hear them. And you know, if you have questions, you can send me them in direct messages or put them down in the comments below. As always, I'm Dr. Corey Babb. I really hope that you've enjoyed this video. If you do, please hit that like button, subscribe, and when you do, ring that bell so you'll be notified of future videos coming up. So otherwise, I hope you have a wonderful day, and I'll see you next time.